like just like when you go to a restaurant and you see that the restaurant was rated a B, I mean, don't you keep walking for an A? Like,
usually, yeah. Sometimes you're already there and you're like, what did you do?
Exactly.
Yeah. And you read the report and sometimes it's not a big deal.
But you have that same right when you go to your physician. Like, hi everybody, welcome to another episode of Truth and Tonic for Women. I'm Dr. Traci and I'm here with Amanda.
Hey everybody.
Hey Amanda, what you been doing?
Just doing all the stuff.
All the stuff.
It's
summer, getting ready.
That's right.
For your summer vacays and all the
talking
things.
about summer cocktails like you wants to make.
I think we need to have an episode on summer cocktails.
I can see what you did there.
Yeah, I see what I did. I can never figure out a summer drink.
It's tough.
Because my drink is wine. Red wine is my thing.
And it's like spritzer. It's like, do you want to do that? Can't say I haven't. I know, like, I really do love a good Aperol spritz, but a lot of people are turned off by Aperol. But I'm like, I like Prosecco and I like the Aperol.
Yeah.
It's good.
Hit or miss for me.
Too much of the Aperol, but like with a good, I mean, it's good.
I mean, if I'm in Italy and they sit one in front of me,
you're not going to get mad. No, why would you?
I'm not mad at it.
No, not at all. So yeah, definitely a summer cocktail edition. But today, I mean, behold.
This is always my summer drink, but I'm just saying when I don't have the cash for this.
Yeah, exactly.
Vouv, if you're listening.
Just saying, we love you so much. You have no idea. There is a bottle consumed at least weekly, so just saying.
Most definitely.
Yeah.
I work it into my budget.
Yeah, exactly.
Budget for both. So today we are going to make it make sense when it comes to all the alphabet soup, when it comes to medical professions and their title. I know it.
You gotta start with yourself.
Yeah, I was looking for it right now. Yeah, so we're gonna make it make sense, probably starting with me. But first, we have to do a little.
Oh boy,
get to know.
Some of these are deep, you guys.
Yeah.
The name of this, it's called The and. Is that right?
Yeah, I don't know.
Yeah.
It is, but parentheses, like, does that mean you can put anything in there?
Yeah, I guess so.
Okay, you go first. I feel like
I
went first last time.
What's not healthy about your relationship to money? Ma'am, it's right there.
Yeah. Shamps is one of them, definitely.
Mine too, for sure.
Definitely. I think that I have a healthy relationship with money in the sense that I love to save and I love to watch it grow, and I don't like to be in a lot of debt. Credit card debt, I mean. But if I need to purchase something, I know I can pay it off. It's not that big of a stressor. But I would have to say champagne, and I'm sort of an in-between clothes and makeup hoe. Like,
I think you're definitely.
I love.
It's like, but you like the. If I have to say this, because I'm kind of getting into that quiet luxury stuff. I hate using that term, but it is what it is. Like, it's good key pieces, but you would never. You're not like, oh, that's whatever labely thing it is. You know what I mean?
Yeah, I've decided, everyone, that I'm doing a capsule wardrobe,
which is a great idea.
Which means that all of my pieces should like go together, so it's not so.
And you can wear them over and over again, right?
With different pieces, so it's a different outfit, but the same piece or item, and it's supposed. You should do something sustainable, so you can keep it and
or invest. It's kind of an investment too, right?
And then packing for your summer vacations easy because everything should just go together. So. Yeah, Champs, clothes, and a little.
How is it going with? Well, I'm definitely not. I mean, I don't need to talk about myself, and I certainly don't. But I do like good products, and it is what it is. Whoopsies. So I would definitely spend money on that I probably shouldn't. But how is it going with the capsule? Though, like, are you?
I love it because now when I shop intentionally. So I can see something. Yeah, I can see something because I just started. So I do need things.
Right.
And there's summer and there's fall in Atlanta. I mean.
Yeah. We get all the seasons. We get them all.
Yeah, we get them. but not like jackets like in New York. So it's good because I can see something and I'll think to myself, that's really cute. And I'll think to myself, but does it go with everything that
do I need to buy this? And I actually think that that would work for me, like
Yeah.
in a psychological level. Like, this doesn't go with my stuff. Like,
It's very helpful in that sense. Now, if I see a dress, because, you know, we all have those occasions that we're going to go do this, that, and the other, and you need something that makes you feel good. And, of course, you don't want to wear the same thing over and over again. I let myself go with, like, color that way. But my capsule right now is like beige and black, which means I can play off the grays and the browns.
Yeah, that's smart. Neutrals.
Yeah. So I'm pretty happy with it. Okay, I do like it.
Yeah. I'm very intrigued by this. Oh boy. Okay.
Your question. Mm-hmm. When was the last time you felt truly encouraged and supported?
Wow, that is a good question, because oftentimes I think I'm not either one of those things by anybody.
I mean, I feel like on Thirsty Thursdays you are.
Yeah, I probably am going to refer to a Thirsty Thursday, which was like, this past Thursday, which, because we had a great conversation.
Thursday, I like that. Thursday.
That we had a good conversation about where we wanted to be, and you know,
if money was no object,
which is an object,
what would you be doing?
Yeah,
with your
but it was
life
a good
to live
question.
Your best life? Yeah,
because I think it is a good way to figure out like kind of where your passion is. So I think so too. I think, you know, like I think our little group of Thirsty Thursday ladies, and sometimes some dudes from time to time. Like I think
when we allow them.
Yeah, and that's rare. I do, and one reason I think that we all have a good friendship. I mean, we all lift each other up and encourage each other, and you guys are pretty good, especially like, even though I don't let a lot of people know, but sometimes like life can be real shitty sometimes, and I don't say that, but like sometimes, you know, you can just say the right person to somebody and it'll make you feel some kind of way. So I know that particular conversation was eye-opening, and it was a good question to ask, and I think that you asked that question because you're generally curious, you know what I mean?
Yeah.
So so Thursday. So thanks, man.
You're welcome.
Yay. We're not gonna like make out right now or anything.
Okay, so we're gonna start with this alphabet soup. It's very interesting. So I'm gonna start with myself because everybody's like, I don't understand what's going on. So I'm a registered nurse. So I went to college for 4 years. It's a 4-year degree, a BSN, and got a nursing degree. And then I decided that I wanted to be an advanced practice professional, and I went to get my master's. Now you can get your master's in different disciplines. I chose women's health and midwifery, which are two totally different things but the same. They deal with women, but a nurse practitioner that deals with OBGYN deals with GYN issues. They can see pregnant patients, but they don't deliver babies. A midwife literally delivers babies. She usually works, if she works in the hospital, there's always a physician there. Invisalign.
Again.
Yeah. To help with any emergencies, high-risk cases. So a midwife, a certified nurse midwife, and I'll explain why I say that in a minute, we usually take care of low-risk births. So I would not deliver twins, let's say, or someone
like a geriatric pregnancy that was like
that would be fine.
As long as
an
there wasn't
obese patient, maybe someone with a high BMI, hypertension. Some midwives do work in places where they can deliver mothers who have like hypertension or that type of thing. It just depends on where you work and who you work for and what you learn. So there's also a certified midwife. And a certified midwife is a person who goes to midwifery school but not a nurse. Mm-hmm. So I feel like I tell everybody that nursing was my residency. I learned how to speak to doctors, learned how to speak to patients, learned how to put in IVs, give medications, put in Foleys. A lot of times you can have a certified midwife who doesn't necessarily know how to do an IV or a Foley, but they know how to deliver a baby like I would. I just have, I would say, additional skills in the beginning. It's not that they wouldn't learn that down the line, but going to school as a nurse, those are your main responsibilities: IVs, medication, all the, trach care, ostomy care, all the things. So then after that, I decided I was an adjunct professor at NYU and I love teaching, and I decided to go back and get my doctorate at NYU again so I could teach at a private college if I wanted to. So I could have stopped at my master's, I think, and taught at a state school, but I wanted options. So what that means is I went back and got my doctorate of nursing practice, which means it's the highest degree that you can get in nursing. So I call myself Dr. Traci because I have a doctorate, but I'm actually an advanced practice nurse. I'm a midwife and I'm a nurse practitioner of OB and GYN. So that's a little alphabet soup that I have.
You're all souped up.
I got all my things.
You do.
So yeah, I'm not a medical doctor. I have my doctorate. It's just like when someone goes to get their, so you have a doctorate, you have a PhD. Mm-hmm. So you call your professor Dr. So-and-so, they probably have a PhD. Correct. So that's why they're doctor, whatever. Mm-hmm. And so like in your profession, tell us about some of that alphabet.
So I've got two things. So I'm just going to start with the first one, which is physical therapy. And so it's a requirement, it has been for years, that physical therapists are DPTs or doctors of physical therapy. Same thing, they go to school, but there's also residencies, there's board certifications and specialties that they can do. So their titles are PT, physical therapist, comma, DPT, doctor of physical therapy. There's still some MPTs out there, which means they're masters, but that was a long time ago. So the reason we bring this up is there's a big lawsuit, actually, I think it was Lifetime Fitness, that they had a personal training company. It was called Dynamic Personal Training, but their shirts all said DPTs. And now the people that were trainers probably did not know this, but it's dangerous because you're licensed professionals, right? So there was a huge issue because with this licensure comes protected titles because it protects people. So there are a lot of people out there, athletic trainers are another one. They're also licensed professionals, and ATC you commonly see. There's a little bit of an overlap there, but primarily your ATC or your athletic trainer should not be performing physical therapy, but they are your first responder if you're playing on a field and you hurt something. Always. Like, those are the people that are running out, getting people on the stretchers, wrapping, icing, doing that stuff. They're essentially first responders, and that's what they do. Then the other one, we'll talk about chiropractors, for example. So physical therapists, as I mentioned, tend to go to school now for 8+ years. Chiropractors do not have that extensive of an education, but with their own right, they also have their doctor of chiropractic medicine, right? So they have their own specialized thing. They can also, they might be able to get more advanced certifications. But technically the issue that comes there, a chiropractor cannot perform physical therapy. And if you go to a chiropractor that is doing that, they're literally practicing
not under their
scope of their practice.
Exactly.
And the same thing, like if you had your certified midwife that isn't an RN trying to give people IVs, they're not really supposed to be doing that, correct? Like,
well, if you're a certified midwife and you're in a hospital long enough, that might be a skill that you pick up.
And that would
we should be able to put in IVs because if you deliver at home,
yeah, sure,
they need an IV. But I'm just saying it's not part of like their everyday.
They're
thing.
Okay, but that's something they could do. But so, but they would technically be within the scope though if they did do that.
Yeah.
Okay. Versus like if like you're not going to go in and perform any kind of surgery because you're not a surgeon.
Right.
So, but you're not going to come in there and say, I got it.
Yeah.
Like even if you saw a procedure.
Like for me, especially. So as a nurse practitioner, as a midwife. So as a midwife, I'm certified, which means I sat for my boards and I was certified, and I'm licensed. As a nurse practitioner, I'm licensed. I didn't sit for a certification because as a midwife, I can do everything a nurse practitioner of OB/GYN can do.
Right.
An NP can't do what I can do. So I just chose which to be certified, but I'm licensed in both. And just like a nurse, 4 years, you sit for your boards and you become licensed. So I write prescriptions for women. I do not write prescriptions for men unless it's related to an STI, because under my scope of practice, I studied women.
Right.
I didn't study men.
Yeah.
In that way.
Exactly.
Yeah.
And that makes sense. And that's your scope. Another one that I have is registered dietitian or RD, and then certified nutritionist. So I'm a certified nutritionist. That scope varies greatly from state to state. It really depends. And so whatever state you're in, you really need to look at any practice act because they're not all the same. But with that said, nutritionists, I mean, you could be a nutritionist and an RD. Like, I don't know why you would do that, but we do different things. We're supposed to work together, but obviously I'm not going to go help somebody that has a severe medical condition. It's out of my scope. They would need to go to a registered dietitian for that. But if somebody's
like diabetes,
yeah, exactly. Like that. And I can tell somebody what to eat. I can tell them, there's lots of things I can do that an RD can do. But like an RD would work, they primarily work in like hospital settings, and they're doing tube feeding or special kind of meals for people, cancer patients and stuff like that. And they're really geared in on that medical aspect of the nutrition. It's not the same thing. An RD is a licensed medical professional. Nutritionists aren't, at least not in the state of Georgia. It might be different other places, but that's another thing to pay attention to.
Right.
And we keep bringing this up. We all know what MD means, medical doctor, DO, doctor of osteopathy, which is within that scope as well.
I don't think that everybody knows that. So you have a DO and you have an MD.
Yes.
So your medical doctor is more geared towards medicine. Mm-hmm. Where your DO is more geared towards homeopathic.
Maybe like a naturopath. Like that's what they will do. It doesn't mean that they're not medical doctors.
Yeah, it's still the same amount of time in school. It's just a different way of looking.
Yeah, exactly.
So I know, people, residents where I practiced, some of them were MDs and some of them were DOs coming as a resident to get board certified in OB. Yeah. So... It's same.
It's crazy, right?
Same. Yeah. I know it's a lot. Like maybe we should have a drink because that was a mouthful. Yeah. And we're not even done.
No. And the point of all this too is to educate you guys that there are tons of licensed professionals. I mean, you've got your psychologists. They're licensed professionals too. Psychologists aren't psychiatrists though. Psychiatrists are going to prescribe your medication for you.
Social workers are also therapists.
Correct.
But they can't give you medication.
They cannot, and they're not licensed. So it's a different scope there. You just have to be careful and check your licensure and understand. That's why you need to know what these terms mean and like kind of what you're getting into so you understand it. I thought that you
could be a licensed social worker though.
I don't know if you can or not. Maybe not in the state.
So, but we'll get back to you.
Yeah, well, we're going to double check.
That's a question mark.
Yes,
because I think you can. And it's crazy because two of, people close to me are social workers, and I should know the answer to that. But I've never.
Neither one of us do.
I've known that they've taken boards, but I kind of think that you can be licensed. But I will find out the answer to that.
But I also think you could probably work and not be.
Yeah.
And you can go to any state board licensure and pull somebody's name up. So if I have a good friend of mine who's a massage therapist, also a licensed professional. They touch people. They've got to know about conditions you have. They have to know the anatomy. And anytime you have somebody who's putting their hands on people.
Somewhere in the room where you go for your treatment of whatever it is.
It's supposed to be displayed somewhere.
I mean, supposed to be. most people would want to display it.
We
so
would
if
get
it's not there.
That's true.
That's when
Red
you ask
flag.
questions.
We would get in trouble if like CMS, which is Department of Health and Human Services, Centers for Medicaid, Medicare Services, if they did it and we accept that insurance at my practice, that's a whole other thing. But if they were to drop by and you don't have that stuff displayed, I mean, it's not good. The same thing with a bunch of other stuff you're supposed to have. But with that said, licensure is usually there's a time frame that you can renew that. If every state has a Secretary of State website where you can put in somebody's name and determine if they're licensed professional. Yeah. Either they're not going to show up.
We have to pay every 2 years to keep our license
you
up.
do.
So, and if you go to work without a license, they will quickly tell you to go home.
Yeah.
Until you get it.
Exactly. That's the sad part. It's like, how long will you go? Like, there's all these horror stories about there. Go listen to the podcast, Dr. Death. It is fascinating and disgusting at the same time. And there's a few different episodes about that, but it's these people should have been had their licenses revoked or suspended, and they are eventually in jail, but not after they killed people. So, it's this crazy thing, but this is why this is important to understand that. But a massage therapist is a friend of mine, also licensed, is had to turn somebody in because she found out that this person she knew was saying that she was also a massage therapist and had not done anything, had not gone to school, had not done the training, not done anything. And, we've talked about this in other episodes as well, that even though there's you can go to YouTube and look at stuff, and I think that's a great resource. It does not mean you can diagnose. Right. It does not mean you can treat. Yeah. And
basically anybody that touches you should have some type of certification to do so.
The bare minimum.
I'm certified for Botox and fillers. I have my certification. Like, that would be something that I would display. Like, when you're going to get these treatments, facials, all of that stuff.
Estheticians, also licensed. And I bet y'all didn't even have any idea, but they touch your face.
Yeah, they have to know what's going on with your face.
They do, and they have to be licensed.
Yeah. Nail technicians
have to be licensed. Fun fact, boxing coaches have to be licensed too. Yeah.
That makes sense.
It does.
I don't even know why I feel like that's shocking, but yeah.
But it kind of is, though, because you didn't think about it, but they have an active license. So if you go to a place and they have a boxing gym, if they're not licensed, and that one's kind of wishy-washy for me, because I'm like, all right, but like if they're running a business like that, they have to be licensed. Yeah. Because there is protocol that you have to take to make sure you keep people safe. Insurance is like astronomical.
When it's like hitting,
make sure. Then there's first aid protocol that they have to know how to do. I mean, bloody noses or whatever that you have to do if shit happens. Which I thought that was interesting too. But you can check all this stuff, but you don't need to be swindled,
right? Or
put yourself in danger.
And know that when you go to a hospital, not everybody in scrubs is an MD, right? Right. Everybody, I know that lately, over the last couple of years, we did it in New York, and I think it works somewhat similar down here. Doctors wore a color, surgeons wore a color, nurses wore a color, MAs, because people, when they did surveys, they found that no one knew who was coming in and out of their room. Like, are you my nurse? Are you my this? Are you my that? So like in a hospital, and as well as in a doctor's office, you can have an LPN, which means that you're a licensed practical nurse, which is different than a registered nurse. Your roles are a little bit different. LPNs usually work with your RNs to give medication. They can I think some of them can start IVs. It just depends on what's in their scope of practice. You have MAs when you go to the doctor and you think, you go to a room and someone comes in and she's taking your blood pressure and she's asking you about your medication. That's usually a medical assistant, which means she goes to school. I don't know if they're necessarily certified. I think that's just school.
I think that they can go, and
it's like a two-year
technical
school.
Thing, and there's minimal training that they can get.
I know they have to pass tests to make sure they know how to take your blood pressure and blood sugar. And
they're mostly supposed to be doing like the charting.
Yeah.
And there's things that they can do. I mean, they're, like they can come in, do all the blood pressure, talk to you about your initial visit. Why are you here? What are you doing?
But they should not be talking to you about medications and this, that, and the third.
Yeah. Don't inject you with anything.
And with an RN, you can have an associate's degree or you can have a 4-year degree. And that's why I said I got a BSN, which is my bachelor's. But you can be an RN and have a 2-year degree as well. So there's a lot of alphabet.
There is, and there
out
is.
there in the world.
And I will say, even with all the alphabet soup and all the things you can do, the experience is really going to make a more seasoned practitioner, just because you have all the letters and whatnot. Right. You know, we all know that there's all good and bad in every profession. Yeah. But it is kind of crazy the amount of people who are out there, especially in the health and wellness field, that will sit there and say that, oh yeah, I can totally do physical therapy, and they're a person. They have never even sat for a NASM thing, which is a voluntary board, not even a board. It's a voluntary course that somebody can take if they want to have a certification to be a personal trainer. Anybody can walk up somewhere and say they're a personal trainer, but they can't say that they're a PT or DPT because those are protected terms for this reason, because they don't know. They can't diagnose. They can't treat.
And everybody has the scope of practice, right? So let's just say you're pregnant, you break your foot, you this, that, and the third. Your sonographer, the person who's like taking your x-rays or doing your ultrasound, they take the pictures. They're not allowed to tell you what they see, even if they know.
It has to be read by an MD.
It has to be read by a radiologist or an MD.
Yeah.
So everybody, when they get certifications or they get this alphabet soup, they all have a scope of practice. So I know a lot of people just think that when you go in somewhere and you have on scrubs that you know everything, or you should know everything. You need to be aware of who you're speaking to and make sure that you're addressing the right questions to the right person. And it's okay if you go to a doctor's office to ask the question. I mean, I know that people go in to see a doctor sometimes in a OB office, and they oftentimes get a midwife or an NP because they have those people in to help them, you know, see more patients.
They can't do everything. And that's why ancillary providers are so important. Yeah. And in fact, and you can probably speak to this, you probably do more and know more than a lot of those OBs do.
Yeah. I mean, definitely more than the residents.
Yeah, for sure.
Here's a nugget of information that I stand by.
Love a good nug.
If you are going into the hospital, if you need to see a physician, if you're having a baby, ask for referrals, but it is completely in your right to go to this hospital or go to this doctor's office, because rarely do doctors, midwives, or anybody practice solo. To ask the nurses in that office, what do you think about this guy? What do you think about, like, what's his,
bedside manner?
Yeah, bedside manner. What's his C-section rate? How does he treat his patients? Do you think he has a bias? Like, nurses know what we know, and we're more than willing to tell you. Well,
yeah, you're not going to fuck around.
We're not going to be like, like, we tell the truth. Like, come on.
I agree.
It's important.
100%.
But, I mean, to go in blindly.
And a lot of people do, because they get scared. I mean, like, you're just like, yes, ma'am, or yes, sir. Or whoever tells you that, because they have on the appropriate, like the white jacket or whatever it might be.
And guys, a lot of people wear a white jacket. So
it's not
I explained to you that I'm a midwife. I wear a white jacket. Not because of the doctor part of my name, but because I'm a professional. It's an advanced practice thing.
So you wear a white jacket.
So I wear a white jacket. But lab technicians wear a white jacket.
DPT students
wear a white jacket. Nursing students wear white jackets. Yeah. So white jacket doesn't mean I'm an MD. Exactly. I'm not a medical doctor. Maybe I play one on TV. But.
Exactly. Or I'm going to play one when I like ruin your life because I'm not I don't know, some fucked up shit.
I mean, I have to, most times, if you have a white jacket like I had, it said CMN. CMN.
Correct. And that's another thing in a lot of medical professions.
CNM.
You're supposed that one's hard. Say it again.
CNM.
Boom.
Certified Nurse Midwife.
Yes. So I do know that, and I know that I've been places and people aren't wearing them, but you're supposed to wear some sort of badge or name tag to identify yourself.
Most definitely. If you walk in an office and someone doesn't have a name tag on, like, no.
Yeah,
you ask for the name tag. And another tidbit, if you're walking into an office and someone attempts to touch you and you didn't see them wash their hands,
Why is
please
this
tell
even a
them
thing?
please tell them to wash their hands.
Yeah.
Whether you're in a doctor's office, a medical facility, like someone taking labs, for instance.
At the bare minimum, use a hand sanitizer.
Yeah.
Like you can't always like get to the.
Yeah.
But I mean, our
Especially a hospital.
Yeah.
Like, everybody who comes into your room is supposed to wash their hands.
Yeah.
You are supposed to literally see them washing their hands. It's part of...
Yeah, 100%. I mean, those are literal laws. Like if you're going to open a private practice or you're going to run a hospital or whatever, like we have to have visible sinks.
Yeah.
People, I mean, hand sanitizers everywhere. And then granted, not every patient, when they come through the door, most of them get some sort of an examination, and you have to make sure your hands are clean before, and you got to wash them after. And I, to my knowledge, I've never run into that issue. Everybody knows what they're supposed to. Thank God.
Yeah.
But I'm sure it happens. And I'm sure sometimes it's probably by accident.
I mean, but seriously, so for me, since I work in the hospital environment, like even when I go to get my nails done and get a mani, a pedi, and I don't feel like things are clean, I'm walking out of there. Like, did you clean that before I came and put my, you know what I'm saying? Like, it's not just medical. It's like you go get a facial, you get a massage. Are you washing your hands? I've gotten a massage and someone coughed over me and I was like, okay, wait a minute. I felt your breath. So that means
no, you should not
that you did not turn your head. Like you are a customer. They are a provider because they are providing you a service. They need to take the necessary steps to make sure that it's an environment that's clean and tidy.
100%.
I mean,
yeah.
You know, I guess I don't really hear that much about it anymore when people will go get their nails done and get an infection.
I haven't heard about that in a long time too, but I think a lot of that was with some of this trendy stuff. Yeah. And I also think it might have been with some unlicensed professionals. And like within that industry, a lot of it's run by immigrants. And like if they're like taking shortcuts or... you know, hire somebody. I mean, not just because you're a licensed professional doesn't mean that you're a good worker or an employee or good at your practice or whatever it might be. Of course, mistakes do happen, but I haven't heard of anything crazy happening. But there was like a huge
run
thing of people getting infections.
I know in New York, it was like everybody was just like, what do you like? You could see them putting their equipment into like the UV things and like coming with like clean things, showing you what they were doing, which is what they should do.
The other thing too, we have to address dentists and oral surgeons and
because you know, you guys, it's all different. Your dentist is where you get a cleaning and a checkup and your cavities filled, right? And then an orthodontist is like Invisalign over here.
Yeah, your braces.
They're moving and shaping the way you want your teeth to look.
An oral surgeon, so you can be a dentist. A dentist can also perform surgery, but they're like they can take out your wisdom teeth, but they're not going to put you under. Like they're not going to put you under.
Well, I think the cool thing about an oral surgeon is that they went to medical school.
They're MDs. And
they're
so
MDs.
They're MDs. They can administer the propofol or the Demerol or whatever you need if you're going to do. Because I had my wisdom taken out when I was 18 and it was quite an experience. But I went to an oral surgeon. So I was put under and I was in an anatomy and physiology class. And I remember for some reason I told, you're all going into magical drugged up dreamland and asked them to save my teeth. And I took my teeth in and got like I basically got 100 for the year because I turned into my body parts, which was so crazy. But I know people who have gone to a dentist to have their wisdom teeth and they can numb you up for days. Yeah. But you are awake during that entire process.
And you feel that pulling,
and the smells of all the drilling and stuff, and you can hear it all. That sounds awful.
You gotta love your dentist because I swear it still freaks me out.
I do
not like them at all.
I don't either, and I have my own qualms about some dentists and their practices in general. But we also have to think about that stuff. And an oral surgeon is an MD and went to medical school.
I went to with the Invisalign, I have to go like every 2 months so they can make sure that my teeth are moving the way they were supposed to. And I just went for an appointment and it's usually the same thing all the time. And I have my goggles on and my doctor that I'm talking to. So I actually go to the school. So I get a little bit of a discount. So
they need mouths to practice
on. So the residents are who's doing all the work and then they consult with the doctors. And he's like, open your mouth. I'm going to do this, blah, blah, blah. And I open my mouth and I look up and there are two people standing over me. One is holding something and the other one's doing something else. And I'm like, I took off my glasses. I was like, what is going on? And they're like, excuse me. I'm like, why are two of you looking down at me in my mouth? And they're like, what do you mean? I'm like, I come here all the time. One person is in my mouth. You can confer over here. Why are two people in my mouth? Like, tell me what's going on, or one of you have got to step off. Yeah. Like, I don't know what you're doing right now. I don't feel safe. What are you doing?
I went to a dentist like that, and this woman, I was doing the x-rays, and that's always very uncomfortable anyway.
Yeah.
The little things that you put in.
Yeah.
She almost like dropped one down my throat, and like the dentist was there, and it was this huge issue, as it should be, but I'm like, this is real awkward, and I'm like in the chair like, oh shit. Right. Like,
and they were speaking in a different language.
Yeah, and it's also,
and I was like, no.
Rude.
You guys need
That's
to
not professional.
Right. I said, you guys need to tell me what you're doing. And they're like, well, if you have a problem with it. And I said, no, I don't have a problem with it, but you need to tell me why all of a sudden on this random day, two of you are staring into my mouth.
Yeah, it's just
like, did something happen?
Yeah,
like, do you see something? What's going on?
And they need to bring in, like, because obviously if you go to an OB appointment, I know every time, like, we do that, it's rarely just me, and even if it's a female physician, it's rarely that. Yeah. Just a nurse is in there.
Yeah.
And I know that they need help with the procedure or whatever, or whatever, but they need another set of eyes, especially when you're dealing with stuff like that. And it's just professional. And it's protection.
While we're talking about protection, another little tidbit: if you are a female and you are being examined by a male physician, there should always be a woman in the room with that physician. You should never be in there with a male physician alone.
100%.
So just know that you have the right to say,
so I want somebody else in here.
Yeah, doctors should at this point be well aware of that, but
to save their own asses. But we don't need to go into
they need a chaperone.
Steps.
Like, basically ask for a chaperone. Don't ever be examined alone by a male. Not that it's just for
not
safety.
making the assumption, but it's safety. You just never know. And not to mention on the physician's point too. I mean, our therapists, like, they're not allowed to be alone with teenage girls by themselves, and that sounds weird. We treat a lot of high school athletes, and they have to come after school, so somebody's got to be present.
And it's
at
two
that
ways.
Time, but it's protection.
People have mental issues. They can say something happened.
100%.
It didn't happen. It protects the physician as well as as the patient.
So if there's somebody that they don't feel comfortable, or just in general, we have some bold male patients that we'd never let a female therapist be alone with. Yeah. A lot of them are older men and they think they're being cute, but you're like, you're not. Yeah. Then that's a whole other issue too. Yeah. But like, you just have to, with an office staff, you have to communicate that. And, but also as a patient too, you need to, you all have to be your own advocate. And
same with, eye doctors. Now, I always get confused.
Oh, the ophthalmologist, the optometrist.
One's a doctor that handles like glaucoma.
So that's the ophthalmologist, is a medical doctor.
Right. And
optometrist is just
glasses. Just an eye exam. If anything's wrong, they'll refer you to the MD.
Exactly. And they'll deal with your glasses and stuff. Or an tech or something like that.
Exactly.
Yeah, that's also another,
there's so many.
I guarantee
no wonder
we're
missing all a bunch. Confused.
I know, exactly. But I think like the big thing is you need to know how to protect yourself and verify credentials. If you're not, even if you see it on the wall, like anytime
you do your due diligence,
you have to, and especially if you're at a gym working out. And like I know there are lots of like DPTs that'll go work out of CrossFit gyms and stuff like that. They sometimes do things that are out of the scope of their practice. But there's also trainers that say, oh, I could do physical therapy. I'm a physical therapist. They're fucking not, and they should not. They should not be saying that or touching you and claiming or especially charging you for anything that they're not doing. You don't need to get a massage by somebody who isn't licensed. You don't need to be getting your facial done. Again, like it's not just in the sense of like going to an MD and they're not licensed, and that could happen too. That could happen.
Cosmetologist is licensed. Like
100%.
they need to figure out how to shadow and shade and
but they got to deal with your face. And so they need to know about skin conditions. They need to know like some bare minimum stuff so they don't, I mean, it's an incurred liability at that point, you know, and you got to have the insurance. That's the other thing you need to check on.
Yeah.
Make sure people have, I mean, honestly, like my practice is such like a small thing on this big spectrum of healthcare, but you can't get credentialed for anything to get paid if you don't have any kind of malpractice insurance.
Yeah.
And if you've had multiple claims and people do get sued, and it's not just MDs, they get sued for stuff, like you got to make sure you can't practice if you don't have any insurance either. So you got to check all this stuff. So it's kind of like, it's not just your contractors or any of this stuff, which is also important, but this all extends to the medical community too.
Yeah. And you can ask for license, like just like when you go to a restaurant and you see that the restaurant was rated a B. I mean, don't you keep walking for an A? Like,
usually, sometimes you're already there and you're like, what did you do?
Exactly.
Yeah. And you read the report and sometimes it's not a big deal. But
you have that same right when you go to your physician. Like, you have to be an advocate for yourself because it's so challenging these days because like we're saying, we're doing a show on alphabet soup because there are so many initials and people are so many different things. Even in my profession, like I look up stuff I'm like, you're a what? Like,
for sure.
What does that stand for?
Yeah, for sure.
Like you're
can't keep up
certified
with
in this and you're licensed in that and you know.
Plastic surgeons.
Yeah.
They have the most alphabet soup.
Yeah.
I mean, they're MDs, but they do surgery. So they do something else to become surgeons. And
not all doctors can perform surgeries.
Correct. There's a lot of this goes with this extends to orthopedic in particular. There's tons of non-surgical orthos. They're MDs, they specialize in orthopedics, but they are not the person you're going to go to get surgery if you need it. They refer out, they refer to PT all the time.
Right.
But plastic surgeons, I have to look up what that FAA, you know what I mean? Like they have tons and it means different things. Yeah. And that's usually your certification. So your main title, like for example, physical therapist, DPT. So PT, DPT, but then you can also have an OCS certification, OCS or board cert. I mean, it can go on and on and on and on and on. And I'm like, I don't really remember what that means either.
Yeah, BC is usually board certified.
Yeah.
A C before after is certified.
Yeah.
Yeah, there's a lot.
There's a lot. And just ask. But what's great, Secretary of State website, there's a big thing that says, and we can post this, have this posted, where you can just search. So if you ever have a question or somebody tells you something or you're going to go see somebody and you just want a bare minimum, just make sure you can totally put in their name. It's very simple. It'll pop up with an active, inactive, or whatever. Hopefully they're all active. You can click on it and see a big history and just make sure that that specialty matches what they say that they're going to do. Right. I think for the majority, you're not going to have a problem with that.
Right.
There's also a big link to submit a complaint.
Yeah. But you know, just think about your safety. Remember, if you're going to someone and they're working with your face, you'll want to make sure that they know how to work with your face.
Yes.
You're going in somewhere and you're getting plastic surgery. Please, that's one of those times that you really need to talk to people who have had surgery by this person. Like, not just the good stuff, the bad stuff. You can go online. You can see any complaints. You can see some of the pictures of things that have happened.
And plastic surgery is an interesting thing, though, because for the most part, yes, there's things that happen to people, accidents that get disfigured, whatever.
Yeah.
I don't mean whatever, but you know what I mean? Like there's things like that it might be a medically necessary thing. But for the most part, plastic surgery is completely... it is a voluntary thing that you decide to do. It is still surgery. Yeah. And it is really interesting to me, the disconnect that people have between, I don't know, going to get a boob job or anything with your butt or any of all that stuff, the crazy stuff that people are doing. But I'm like, that is still major surgery and people die. You can get an infection and die.
Especially when you go to another country.
Yes.
Other countries have different standards.
Or none. Yeah. Or no standards at all.
Different standards. And it's so much easier for doctors in another country that aren't actual licensed professionals to get away with it because all their paperwork looks different. All their things are different.
Yeah,
because
or they don't
it's
have
another
the
country
program
and
to
another
do it.
language.
Yeah, or they don't have the program to do it.
Yeah.
There's no way for them to get certified or board certified or
Right.
licensed for anything. You just have to be really careful with that. I mean, crazy stuff's going to happen. Everybody, a body is different. Things are going to happen to people. You just have to hope it's not because of negligence, but sometimes that does happen, and no one's perfect,
Right.
but still.
And we forgot about anesthesia. So
Oh,
you can have an anesthesiologist, but you can also have a certified nurse.
Anesthesiologist, yeah. They
Anesthetist.
changed the term, so it's now
Yeah.
it's just nurse anesthesiologist.
But they have to get their doctorate now.
They do. Good. Okay,
Yeah.
well, there you
So
go.
it's like a part of the program. But usually the doctor is over everything, and then a CRNA, which is the nurse, comes in and like monitors things. If there's a problem, she notifies the doctors. Kind of like when, as a midwife, we have a patient that needs a C-section. We don't do C-sections. We can first assist, which means help the physician, but we need the physician to
great
initiate.
example of that, because I don't know a ton about that because I've never had any kids.
Yeah.
But like to say that like you obviously would not be, the C-section time, here we go, even though you've seen it 875 times, it doesn't mean that you're appropriate. It doesn't mean that you need to be performing that. Like that's a perfect example. And I think that professionals in general get kind of, well, I know what I'm doing. I'm like, but you understand that you can get, if you mess this up, you are so screwed. Yeah. And it's like, think about that.
But sometimes they're not, because sometimes people don't have the means to, go after someone who did not do the appropriate thing. So kind of like hedge your bets and think about these things before you go see your medical professional or your, nail tech or.
I mean, seriously, like think about these little things that you do that you had no idea that they needed to be licensed. Yeah. And think about it. Like, I mean, it's, you just really need to just watch out for yourself and protect yourself.
Like an esthetician, like
absolutely.
facials, what have you, they aren't certified for Botox, fillers, needles, that type of thing. Yeah. So even within that world.
But that's the other thing too, especially if they're a private practice or working for themselves. But if they work with an MD or dermatologist is another one.
Yeah.
They can learn how to do some of that stuff, especially with the lasers.
They still have to be, lasers.
Yeah, they can do lasers, but you wouldn't just walk out and know how to do
anything with needles.
Anything with needles, right? You would need to have a nurse do that at the bare minimum at that point. So just
I think like peds is the only thing that's like, it's pretty much peds.
Very true. Very true.
Thinking peds.
Pediatric. Yeah. I mean, they have, so anybody, pediatric orthopedic surgeons, but it's just because anybody under the age of 18 is considered a pediatric. So
they can go up till 21 now, I think.
I'm not surprised by
it's
that.
So crazy.
Because
some people just feel comfortable and the doctors keep saying, you can come in.
Yeah, I think so. But it's like, okay, you're 21 now.
You should probably, I am under the impression that you should have your daughter go see an OB, GYN, whichever, at like 15 just to talk. So she knows that there's another doctor outside the one that has like the mushrooms and the stickers all over the place.
Yeah, there's probably some like Patch Adams fucker.
So
like Robin Williams.
So many people you're 20, you're 18, and then you go to a regular doctor's office and they're like, oh my God, this is so stringent.
And obviously if they're sexually active, they definitely need, and they probably need a pelvic exam, which I think that would be super important.
21 or sexually active.
Yeah, for sure. 20, really? That's crazy.
Yeah.
I'm sorry, I'm still with the firm 18 rule. They don't make them like that anymore.
What, for a pelvic exam?
No, I'm just saying for like anything. Like if you're 18, I'm sorry, you're still an adult. Scoot, get out of my office. You're not getting a sticker.
Oh, you mean for peds?
Yeah, for peds, anything.
Well,
get out.
I guess people, they're comfortable with what they're comfortable with. I was talking about 21 for a pelvic exam.
Pelvic exam, yeah. Yeah, I guess so. But I mean, and I get that like a pediatrician is still an MD, but come on now, you gotta. They specialize. Children, obviously, little adults, little people, but they do have different needs, and that is a very specialized field.
I mean,
just
very bodies different. Are just different.
Very different. So,
and I think that even I saw a lot of patients that were 11 through 16 for period information, like, you know, menstrual period. So I don't think that pediatricians really delve into that all that much. They kind of
which is nuts, because they really should, because that's when that's gonna happen.
Yeah.
And
I mean, I think they know, but I feel like your women's, you know, providers just know more about it. Yeah.
Well, I could definitely see
nuances
some male pediatrician being like, hey, can you go deal with this? Because
they'll refer
or like have their nurse or an RN or something like go in and talk about that kind of stuff. But I mean, I'm trying to think back, like when I went to a pediatrician, if that was even ever addressed. I mean, you know,
no,
probably not. No. I mean,
I know I didn't talk to my pediatrician about my period.
No, I don't think so.
Yeah, me either.
Yeah.
Did we miss any?
I'm sure we did.
Alphabets?
And if we did, just tell us that we did. Or
letters?
Ask. I mean, we keep coming up with stuff. The last one I thought about was a dermatologist, and
but I feel like that's the other one with peds. I think a derm is also pretty straightforward, unless you can do some types of procedures and surgeries. You might be.
I think that
certified for.
Yeah, I think that's a good question. I don't know, but I do know most derms, like if you got to go get something burned off, like they know how to do that. They know how to do
stitches.
I think a plastic surgeon would have to do Mohs, if I'm not mistaken.
Yeah.
I'd have to confirm with my mother-in-law, because I know she's had it done a couple times, and it looks great. It's like nothing ever happened, so that's got to be the touch of a plastic surgeon. But I do know if you need any kind of like the drainage with any kind of cysts or any kind of because I know that derms can use like lasers, scalpels, all that kind of stuff. I know that for a fact, but I don't know if you.
I mean, they are medical. They are medical doctors.
I don't know how surgical you consider that, but
if they go back and do a surgical rotation, then there's things that they can do that a normal dermatologist couldn't. But then they would have more letters behind their name.
And I have to confirm this, but another one that pops up sometimes, podiatrist.
Oh, see, I don't know anything about that.
It's confusing, because we used to have a referral source that was a podiatrist, and she was a surgeon, but she was not an MD. And I can't remember how in the hell
how's that even possible?
That even happened. I'm gonna have to ask, because
that makes no sense.
That's something that we need to just bring back up. Maybe we can add an addendum to this or whatever. I need to figure out how it works with podiatrists, because they're not always MDs.
And I'm pretty much 100% sure you can be a licensed social worker.
Okay, good.
I feel like I see LSW in my brain.
Okay,
but
maybe.
Like I said,
but you can also practice as a social worker and not be licensed.
Yes.
Yeah. So it kind of just depends on what you want to do with
private practice versus working in
a because the only ones that I know right now work in like
schools,
and they're not licensed.
Yeah, but if you have your own practice or work in a practice, I think you're licensed.
Well, I think we beat this to death pretty good.
I know, right? As always, you guys, we hope we made it make sense with all the alphabet soup and your medical care. Please email us. Let us know what you want to hear. If we didn't answer a question, if you need more information about a question or an answer.
If we messed something up, please tell us.
Let us know.
Yeah. Or if
we'll correct it on another show.
Yeah, we will. Hey, this podiatrist stuff, like, it kind of threw me for a loop. I just never bothered to look into it.
I know, right?
So if...
Sorry.
Yeah, but this woman was doing surgery, and she actually was like... She had her fellowship with a plastic surgeon, so...
She has to be a doctor.
Yeah, all of her stuff. It's weird. It was a weird way she got it, though. Something was odd about it, and I don't know. But all of her, like, surgeries were... phenomenal, because
she had to be a doctor.
She went to she had some sort of residency with a plastic surgeon who showed
would
her
have
these
lost
techniques.
His license if she were not.
So something I need to find. I'm gonna find her too. We're gonna get back to
Amanda's gonna check that
I'm
out.
gonna fact check myself. Anyway, let's drink.
Let's
cheers.
Happy summer. Thanks. Thank you for watching Truth and Tonic for Women. If you have any questions, leave a comment and let us know. Also, follow us on social media to interact with the community. Like, comment, subscribe. I'll see you in the next video.